Visual fields is a way that is also known as confrontation testing. Visual field testing is the only one we use to assess our peripheral vision. Okay? So when you have a patient that you're worried about, like, so for anybody we talked to tonight about bitemporal hemianopsia, for patients with glaucoma, okay, what I'm most concerned when I hear about that is, oh, I gotta do a visual field test, okay? I gotta make sure that everything is okay. When I suspect somebody has a hemianopsia, homogeneous hemianopsia, I'm going to want to perform a visual field deficit, a visual field test or confrontation testing to make sure they are seeing in all their peripheral vision, okay? So if in the case of the lab scenarios, when you turn over your card and you are told that your patient has a hemianopsia, your patient has glaucoma, I don't want to see, I mean, acuity testing, okay, but the best test to be performed in that thing would be a visual field test, okay? When you see anything with a homogeneous hemianopsia, like I said, glaucoma, any kind of field deficit, I want to know we want to perform a visual field, or confrontation. That would be the best test to perform. Okay? When you have double vision, things like visual pursuits, saccades, fixation, that makes sense. Or vergence, that makes sense. But when you see anything with a visual field deficit or glaucoma, you want to perform visual field testing. It should be your first instinct to do. Okay? That's right. 514. Okay. So with visual field testing, what I'm going to do, what you will have your patient do is you're going to do it monocularly, one eye at a time. Okay? You're going to perform both on the right and the left. And what I'm going to ask you to do, Stephanie, is I'm asking you to cover one of your eyes. Okay? And what you're going to do is you're going to position the sticks behind there and you're going to slowly move into the visual field. Okay? Stephanie, I want you to look right here at my nose, okay? What I'm going to be doing is I'm going to be moving the sticks into your vision field, okay? They're going to enter anywhere around here, okay? What I want you to do is keep your eye on my nose and say yes as soon as you hear me, as soon as you see the stick come into your vision, okay? All right. Look at my nose.
Yes. Yes. Yes, we did.
Look at my nose.
Yes.
Okay, so see how she was saying yes every time? See how I went, the 6 areas I went? The right and left superior at midline and the 2 inferiors, okay? That will give you a good observation of what the visual field is. Now, did I write about? You want to test all conscious. So when you see the vision, when you see visual impaired is when, like, if for Stephanie, if I'm bringing this into her vision, okay, and she doesn't see it until right there, that's a problem, okay? She's not seeing it until it's literally right in front of her retina, okay? So for you, if you don't see it, think about if you do it on yourself. You could do it on yourself when you're sitting. I see it all the way when it's right here. Someone with the visual field deficit would not see it till it's right here. I can get I'm not going to quiz you on the actual ranges right now. I believe it's like, I'm not going to say, I could look it up when you guys are practicing it, but I won't test you on the actual. But just do it on yourself and you'll start to realize where normal is. And then picture, like I said, they don't see it until it's literally right here. Okay, but normally I see it out here. Okay, so think about how their function and their observation of their surroundings are totally changed when you're supposed to see something out here, but you don't see it till here. Now do you understand why I say they think things are jumping out at them? Meanwhile, they've been hanging out here the whole time and they just don't see it because their peripheral vision is so impaired.